and it's always good to see you back. I know it's so ironic that we are going to say that talking about waste is one of the most important things that you can do in life. Why? Because a lot of questions come from the biomedical waste guideline treatment system that we have in India. It's a 5 by 5 star MCQ topic, bache. You could be a UG student or a PG aspirant, or even you could be doing your PG residency. Biomedical waste is one of the area where a lot of questions are being asked during this course of the lectures, and I've taken a lot of sources from online sources, and we are very thankful to the Ministry of Forest and Environment, thankful to all the ministries who have gathered these beautiful guidelines for us. This is the biomedical waste guidelines. So a lot of guidelines and training manuals have been reviewed for making this lecture. As far as your CBME based competency which are related to the this video session, these are there in front of you. We are going to talk about the classification and the segregation of the hospital waste. We will talk about what to do in areas which are without there is no access to the common biomedical waste treatment facility, CBWTF. It stands for Common Biomedical Waste Treatment Facility. And in areas which do not have access, or these are the rural areas, and what about the COVID-19? So as far as these competencies, now you can see the topics which I have taken. That will be the lecture plan for the day. We are going to talk about the Biomedical Waste Rules 2016, which have been amended time and again. We will talk about the Common Biomedical Waste Treatment Facility, pre-treatment categories, and so on. We'll take on the lecture. What do you mean by a biomedical waste, beta? Biomedical waste, no MCQ, just for your understanding. Biomedical waste is any waste. It is any type of waste which is generated during diagnosis, treatment, or immunization of humans or animals, or for research purpose or testing of biologicals. Anything is a biomedical waste. So first MCQ is, who is handling this biomedical waste system in India? Please note that the history dates back to the Environment Protection Act, which was started in year 1986. So it came into being in year 1986. After Environment Protection Act, then we had the Biomedical Waste Management Guidelines. They were actually established long time back, but they came into direct being and the hospitals had to follow them 1998. Then we changed our biomedical waste guidelines. That is the massive change called as the Biomedical Waste Management Guidelines Amendment year 2016. So new formulation, new rules were formulated under this guideline. Then subsequently, even on 27th of March 2019, then the government of India declared that the use of chlorinated bags should be abandoned. So now not using the chlorinated bags. So now only the non-chlorinated bags will be used. So that is important date. 2016 Biomedical Waste Management Guideline is important. And then subsequently we had a lot of revisions, and of course we had the COVID pandemic also. So in year 2020 and 2021, we had establishment of the COVID management guidelines. So for your exams, beta, you need to remember that the biomedical waste guidelines, they were formulated in year 2016, and in year 2019 we started using non-chlorinated bags in this program. Next important point is that who is handling, what organization is handling the biomedical waste guideline. The biomedical waste guideline in year 2016, they were made by the CPCB. CPCB stands for the Center for Pollution Control Board. Pollution Control Board. So it is the Center for Pollution Control Board. It is under which ministry? MCQ. It is under the Ministry of, can you imagine that? It is under which ministry? It is under the Ministry of Forest, Environment and Climatic Change. It's a long name. So anyways, you can fondly call it as a Forest Ministry or Environment Ministry. So that is the ministry which is taking care of the biomedical waste guidelines, and the department which is there is the CPCB, that is the Center for Pollution Control Board. So that was your topic number 1 about understanding of the biomedical waste guidelines. So we are talking technically, everything that I will talk is about the biomedical waste guideline 2016. So if you just see the sources that we have taken, the cpcb.nic.in, they will have all the updated sources and the updated information regarding the biomedical waste management system in India. Next is question number 2. What do you mean by the CBWTF? CBWTF, it stands for the Common Biomedical Waste Treatment Facility. Beta, what happens is you and me, we all are doctors, hai na? So if a doctor is here with a stent in his neck, okay, and they do some immunization, some procedure, you do some surgery, you do something. So you will generate some waste. Okay. So what to do with that waste? You have to listen very carefully. This is the most important point, not from MCQ, but the whole next 1 hour is based on this point number 2. The doctor is going to generate waste. The first thing that you need to understand is that the waste segregation has to happen at the place where it is generated. So waste generated, waste segregated. That is the rule the CPCB says us to follow. We all are working under Ministry of Health, right? We take salary from Health Ministry. But the biomedical waste guideline is made by the Pollution Control Board, by the Forest Ministry. Just remember, try understanding this. So waste generated, waste segregated. So we segregate the waste and then we send this waste to a common area, in the hospital only. So yellow goes to yellow, red goes to red, whatever colorful bags or bins we have. So that goes to common area. Now a person from the CBWTF, try understanding that this is happening in the hospital, in our hospital. Now the government, the Pollution Control Board, they have tied up with some private or with a government organization who will work as a CBWTF. They will work as CBWTF. So I can open, not as a doctor, I as a private individual, we can open a CBWTF. We need to take a license from the Pollution Control Board. So now try understanding, I'm telling you the concept of this biomedical waste. Now this CBWTF wala, this person who works as a CBWTF, he will send his small boy in a truck which is approved truck. It has to be authorized transport vehicle. This person will sit on a truck and will go to the hospital, go to the common area, pick up the material from there and go back to the CBWTF. Got it? So now CBWTF is something where the final disposal or the treatment is going to take place. It has nothing to do with you as a doctor. So if you understand this, now comes a very important point. I get up every day and I get a question on social media every day, almost every day. I'm scared of this biomedical waste questions because you guys don't understand this simple phenomena. Please, bache, try to understand that the CBWTF in his area, he is invariably going to disinfect the waste, treat the waste, and then only probably dispose it off. Are we able to understand? Why would the government say that you as a doctor is supposed to pre-treat the waste and then only discard it? Please note that there is no pre-treatment. I hope everybody knows how many categories are there. There are 4 categories. You have a yellow category, red category, blue category, you have a white category. So different categories of waste are there, common sense. So please note there is no requirement of pre-treatment. You are not supposed to pre-treat any type of waste except some situations where I am going to tell you. And those are the MCQs. You are going to pre-treat only some of the waste which could be disastrous for the whole system. Only those waste should be pre-treated. Otherwise, the general understanding is no pre-treatment for these waste. Okay, so there are only few categories where I will say that the pre-treatment has to be done. So that is your general understanding. Please note that every city, every town, rural, urban will have a CBWTF. There are, of course, areas like forest areas, tribal areas. There could be Himachal Pradesh. You can talk about Uttarakhand. You can talk about Lahaul Spiti Valley where the mountain ranges is there. So there will be a PHC over here. And the CBWTF is very far off. It will take 2 days to reach that CBWTF because the person cannot fly, right? So common sense. So there are some difficult areas. Government of India is facing some difficulties, but all said and done, every area will have a CBWTF. We as doctors are not supposed to pre-treat it. We will only segregate and send it to CBWTF. Next is point number 3, that what is not considered a biomedical waste. This is another big headache for me. So please note that there are some things which are not considered under the biomedical waste. For example, the solid waste, any general waste. If you are in a hospital, you eat a orange or you eat a mango or a banana, where will you throw the peel? The peel has to go somewhere. You can't consider that peel as a biomedical waste. It will go into the normal municipal waste that is not under the biomedical waste. The electronic waste will go under the e-waste management guidelines. The radioactive waste, hazardous chemicals, common sense hazardous chemicals will not be under this Ministry of Forest and Environment. The construction and demolition waste, lead batteries, all the battery related products, even your implants which have the batteries, pacemakers or cochlear implants which have a automated battery, those are not considered under the biomedical waste. Hazardous waste and hazardous microorganisms or genetically engineered or modified organisms, they are not a part of the biomedical waste. So these form some of the basis for a lot of MCQs which are being asked in your exams. Next is point number 4. What are the signs that we have in the biomedical waste? So everything that I'm talking is the basics right now. So the signs that we have is called as a biohazard symbol, or we can have a cytotoxic waste symbol. They both are considered under the biomedical waste. This symbol, the fan symbol, is a fan waste, that is a radiological waste. It means a radiological waste which is not a biomedical waste. Just now we discussed this. Radioactive waste, that is the Atomic Energy Act. It is not a part of the biomedical waste. It is not under biomedical waste, the Center for Pollution Control Board guidelines. So now let us discuss all the biomedical waste guidelines now. The biomedical waste categories are the yellow category, the red category, the blue category, and the white category. Right? So there are 4 categories of the biomedical waste. I'm trying to give you a general understanding right now. Beta, in the yellow category, we will throw anything which is infectious or non-infectious, anything which is plus or minus infectious. It may be, listen to it carefully, I'm changing my words now. It may or may not be pre-treated. There may be some situations where you need pre-treatment, otherwise you don't need pre-treatment. Please note, there may be pre-treatment or no pre-treatment in the yellow category, otherwise there is in general nothing pre-treated. And this goes only for incineration. It goes for incineration directly. So the basic disposal mechanism of the yellow category will be incineration. It may be pre-treated, not pre-treated, and it may be infectious, non-infectious. That is entirely separate story. Next in line is beta, the red category. Red category may be infectious or non-infectious, whatever it is. But the hallmark of the red category is that it is a rubber. It could be a plastic, or it could be a tube. For example, the rubber gloves, for example, syringes, anything which is rubber plastic tube. Remember RPT. Anything which is rubber plastic tube has to be disposed of in the red category. Please note, there is no pre-treatment. There is no pre-treatment in the red category. No means no. No means no. No pre-treatment in the red category. And this goes for what? It may be going for recycle, or you will send it for reuse. Can you remember this? Please note that the repeat RPT goes for the RPT. That's so wonderful. RPT will go for the RPT. Rubber plastic tube will go for recycle or the reuse. The yellow category is infectious, non-infectious, irrespective. Don't think about infectious. So just remember that red category will not be pre-treated. It has to be reused or recycled or whatever. But the yellow category may be pre-treated in some situations, and it is incinerated, burnt. So you burn it. Now comes the blue category. Blue means blue color. Blue category is for all the glass. Will you remember it? All the glass is blue category. The glass, there is no pre-treatment. Do not pre-treat it. And you send it for recycle or reuse. You can just melt the glass again and people can use it. Why do you want to throw all the glass everywhere? Right? So the biomedical waste guidelines have said that the glass should be blue category. Next in line is white category. The white category is for all the sharps. Will you pre-treat it? Answer is do not pre-treat it. I told you no pre-treatment in most of the situation except few, that is in the yellow category, right? So no pre-treatment, and you again do like recycle it. How do you recycle it? You cut it. All the sharp should be cut to very fine points, very fine material, that is shredding of sharp. So you do shredding and then you recycle, reuse or repeat it. Are we getting it? So very simple to understand: yellow category, red category, blue category and white category. So just to summarize beta, this is what we have done. We have talked about the yellow category. That is, we do pre-treatment in some of them and we send it for incineration. The red category is rubber, plastic tube and you reuse it. Blue category is for glass, you reuse, recycle it. And white category is for sharp, you reuse or recycle it. Is that all? That is the summary. MCQs on this now. Let us have some good, brilliant MCQs. First MCQ. Where will you discard the blood bags? MCQs beta. Where are you going to discard the blood bags? Blood bags. They are containing blood, but they are made up of a bag. So please note that you may say blood bags will be red category, but unfortunately, that's what the MCQ is. Blood bags, including the BT set, the blood transfusion set. है ना बेटा? Blood bags including the BT set will go into, say with me, they will go into the yellow category. Next in line, if blood bags go to the yellow category, the urine bag should go where? Unfortunately, if you are answering red, you are again wrong. In case you are answering yellow, you are wrong. Urine bags goes to the red category. Please note, urine bag will go to the red category. Next in line, where will you discard the orthopedic implants? Implants, these are metal implants. Where will you discard them? Probably you would say that it is in the white category, but please note, ortho implants, they have been given a special category in the blue. These are the ortho metallic implants. The ortho metallic implants will go into the blue category. Next in line, where will you throw the needles or dispose of the needles in the hospital? I think everybody understand all the needles, the scalpels, they all will go to the white category. So a general understanding is, let us say that a doctor or a nurse or a healthcare professional, you go to the area for doing immunization. So when you do immunization, you will need a syringe. So the syringe is there in a wrapper, in a packet. So you open the 5 ml syringe or the 10 ml, whatever syringe you want. You open the syringe. So that wrapper, where will you discard this wrapper? This will go into which category? Yellow, red, blue, white or none of the above? Answer is none of the above. Why? Because it is not a biomedical waste. It is simple wrapper. So please note that if you are talking of immunization waste, the wrapper or the cover of the syringe, it will go where? It will go into the black category, which is the municipal waste. So different hospitals will have different colors. So please note, it is not a biomedical waste. Now let us come back and you do the vaccine. For vaccine, you will break the ampule. So the ampule, you take that vaccine and you inject in that bacha. And what will you do to the vial? Where to dispose of the vial? That is a broken glass. So that vial will go into the blue category. Absolutely correct. If you have answered blue category, the vial will go into the blue category. So let's write down, the vial will go into the blue category. What are you going to do with the leftover syringe? Now the syringe with the needle is there. So what to do? Please note that you put the needle in that hub cutter. You cut that needle and the needle is destroyed and this goes to the white category, and the syringe. And the syringe, that will go into which category? It's a plastic syringe. Syringe goes to the red category. That's how we are supposed to play the game. Please note that in case the vial does have some vaccines into it, all the live vaccines, they go into a special category, that is the yellow category. The live vaccine will be yellow category, the syringe will be this thing. Next, let us practice more. What do you think about the gloves? A person who was doing surgery or a person who was doing dressing, you as intern or anybody was doing a dressing on a patient who is known HIV. So now your gloves are full of the blood. Blood, which blood? It is the HIV blood. Where to dispose this glove now? What do you think you would like to answer? Yellow category? Answer is no, wrong. Rubber, every time it goes to the gloves, goes to the red category. Gloves with blood, without blood, with HIV blood, with hepatitis blood, with syphilis blood, with ABC blood, whatever blood is there, any glove which is stained, unstained, it has to go. Nitrile glove, latex glove, any glove will go into the red category. There is no exception for gloves. Please note, gloves are all red category. Done. Next in point, syringes. The syringe contains a blood sample. Of course, that syringe is going to in the red category blood, but that blood will be taken in the blood. You remember blood bags were yellow category, right? So blood will go to the yellow category and the syringe itself will go into the red category. In case there is a third exception, in case that syringe is with fixed needles, there are some syringes with fixed needles. If the syringe is with the fixed needle, you try to cut the needle. In case you cannot cut it or the syringe is made up of metal, then please note that syringes with fixed needle system, they go into which category? They go into the white category. Syringe with fixed needles will go into the white category. So please note, syringe, the blood will go into the yellow category. I'm not saying that the syringe with the blood will go into the yellow. Only the blood component goes to the yellow, the syringe goes to the red, and syringe with fixed needle, they will go to the white category. So now that was just your basic kindergarten level understanding of the biomedical waste segregation, the different categories, yellow, blue, red, and white. Now let us dive into it and let us see what more complications are there. Let us have a look at the yellow category. If you talk about the yellow categories, the yellow category will have 8 subcategories: A, B, C, D, E, F, G, and H. So there are 8 subcategories: A, B, C, D, E, F, G, and H. Okay. A category, it stands for A for anatomical. So it stands for human waste or anatomical waste. B stands for the animal waste or the bandar waste. That's how I have remembered, animal waste. C stands for the soiled waste. Very important to remember, soiled waste. What do you mean by the soiled waste? Beta, soiled waste, anatomical, I think common sense, animal is common sense. Soiled waste, it contains all the soiled, any dressing material, cotton, gauze piece, any clothes, anything which are stained. So dressing material, even the plaster cast, this can be your MCQ now. Even the plaster casts, they are in yellow ABC. What do you want? ABC, C. Yellow C is cast. Remember, C is cast. And dressing waste is yellow C. Now yellow D, very easy to understand. Yellow D stands for Dawai. Dawai is drugs. So yellow D is drugs waste, that is the expired medicines. Expired medicines. Again, very frequently they have asked question on this. Yellow D is for what? Drugs waste. Yellow E. Yellow E. E stands for the chemical waste. This chemical waste could be the solid chemicals or it could be the liquid chemicals, of course, which are not the reactive chemicals or explosive chemicals. No, they are not the explosive or the reactive chemicals. They are the normal chemicals that we use in the hospital. Could be insecticide, pesticides, and so on. Yellow F category. I have remembered F. F means fluid. Yellow F category. F has 3 things. Fluid could be 3 types in the hospital. First is the X-ray fluid. Please note that in the start I said radioactive waste. Do you remember that what is not a biomedical waste? We had talked that the not a biomedical waste is a radioactive waste, atomic energy waste. So why am I saying about this X-ray fluids? Please note, X-ray fluid is not a radioactive waste. You remember when we were small, we used to click photos using cameras. In that there used to be a reel, and we used to take that reel to a person, photography wala, and he used to develop that in a dark room. In the dark room, he used to put that film in some solution, water. That water is the developing fluid. So this is nothing but the X-ray developing fluid. It actually contains silver nitrate. It is actually containing silver component, and therefore it is important that this goes back to the company where they are producing silver nitrate. They'll extract silver and remake the silver nitrate. I'm not talking of a hospital, one hospital. We are talking of a big country like India. There are so many hospitals on a country level, we cannot afford to have the wastage of the silver nitrate at that. So the X-ray fluid is containing silver and it is considered under the yellow F waste. The yellow F waste, it also contains all the detergents. If you work in a hospital, don't you think that ward boy will be cleaning the floor whole day, morning, evening, of course, whenever they get time. So it's a government hospital. So they'll be cleaning floors. So a lot of detergents are used on a country level, all from Jammu, Kashmir till Tamil Nadu, so many hospitals. So many hospitals, so much detergent. This detergent will go into a yellow F category. You cannot allow that to go directly into the drain. So that is why hospital waste guidelines are there. Why? Because if everybody puts detergent in the drain goes to the water treatment system. In the water treatment system, we get a lot of detergent. So that becomes bad. So the detergents and all the like floor cleaning agents. So cleaning agents, actually, fluid is for cleaning agents. They come into the yellow F category. Yellow F also contains another one, that is the yellow F will contain what all? It contains all the body fluids. All the body fluids, like body secretions, like any fluid. You do ascitic tap, so ascites fluid. You do pleural tap, the pleural fluid. The sputum, the CSF, anything, any body fluid that is taken under the feces, except the blood. Okay, blood is not there. Feces and the urine, they all are considered in the yellow F category. So what is yellow F category, bache? Let's write it down. It is the fluid waste. Fluid waste means the X-ray fluid, 3 fluids, detergent fluid and the secretions, body secretions, the saliva and all that, urine, feces, all this body secretions, they are in this yellow F category. G, yellow G, I have remembered G for Gadda. I know it's such a bad joke that I make. G stands for Gadda. Gadda is what? Mattress. So yellow G stands for the mattress waste, or we say it is for the beddings or the linen or the bed sheet or the bed covers or the pillow covers or the mattress. So everything is in the mattress, is in the yellow G waste or the Gadda waste. Next in line, yellow H waste. Yellow H waste needs a lot of attention over here, beta. Yellow H is anything which is biotechnology. In the start, I said biotechnology is not there, but please note it is biotechnology or microbiology. Laboratory waste. What do you mean by the biotechnology or the microbiology laboratory waste? Any lab waste. That is the culture plates. That is the vials, the vaccine vials. You remember I told live vaccines? Live vaccines are under which category? Yellow H category. The blood bags are under which category? Yellow H category. So H category contain all the blood products. It contains all the blood products. Blood is a very hazardous liquid, right? It's a very hazardous liquid. So blood is under the yellow H category. So can you just write down for your exams what is yellow H category? You can write down that it contains all the laboratory waste which contains the blood or blood products, blood or blood products or the live vaccines. Live vaccines or the microbiological waste or the biotechnology waste, everything is yellow H. So just now to quickly revise with you what are the yellow category waste, beta. Yellow category waste, first A is the anatomical waste. It contains body tissues, organs, fetus below viability period, that is all the fetal waste, and placenta, extracted teeth, everything is yellow A category. Yellow B category, it contains the animal waste, that is all the animal body parts or waste generated from animals in experiments, which of course is not there these days, but all the animal body parts are there in the yellow B category. Yellow C category contains anything which is with body, soiled with body fluids, because it's a yellow C is a soiled waste. So please note, point to be noted, plaster cast. This has been your previous year MCQ. Dressings, plaster cast, swabs, bag containing residual or discarded blood. I will come to that later. These are direct guidelines. I have taken the snapshot touch from the Biomedical Waste 2016 guidelines. I'll just talk to you about this very soon, that the blood has a kind of problem. Next, yellow C also contains infectious materials as cap, shoe cover, blotting paper and all these things. Coming to yellow D, D contains the drugs. You remember D is for the drugs. So it contains 2 drugs types. First is that it contains the discarded medicine. Please note that the discarded or expired medicine will have the biohazard symbol. Next, this yellow D category also will contain a cytotoxic drugs. You take a separate bag for the cytotoxic drug. Use a separate bag for special drugs which are cytotoxic drug. What are the cytotoxic drugs? These are the anti-cancer drugs which are the cytotoxic drugs, and these drugs are taken in a separate bag because, of course, from talking from ministry point of view, these are expensive drugs and they can be sent back to the pharmaceuticals for their remanufacturing. So the cytotoxic drugs are taken in special bags with the symbol C over there. You remember in the start only I told you that both these symbols are actually biomedical waste symbols. So one is a biohazard symbol. This symbol is what? This is a biohazard symbol, and this is a cytotoxic waste symbol. Both are yellow D categories. Yellow E is anything which is chemical, solid or liquid. So basically it is containing disinfectants or so many spirits. We use so many things every day. So these are residual chemicals which are used in healthcare facilities or insecticides, pesticides, everything will be chemical waste. Yellow F, I told you yellow F is important. It is fluid waste. So it contains three types of fluid. What are the three types of fluid? What are the three fluids? Silver X-ray film. It contains the liquid chemicals from floor washing. So actually it's all the washing things, and it also contains infected secretions from body fluids. Next in line is the yellow G. G stands for the gadda waste or the mattress waste or gowns or beddings or pillow covers, everything. Yellow H is where I want you to focus on. This can be your MCQ, and this is actually a nidus. It's a source of doubts in the students. So yellow H waste, can you see that it contains the laboratory waste? So it contains chemical laboratory waste blood bags containing date expired or contaminated blood. Now yellow H is there, and there is also yellow C. Yellow C also contains discarded blood components or blood bags. So technically blood bags, it's a laboratory waste. So I know there is a slight discrepancy over here in the guidelines, but nothing is black and white in medicine, right? So I know there is a discrepancy, but if you get the single best answer, I would like you to go with the microbiological waste because that makes more sense. But C is basically for the blood and the blood products, and H is for all the waste blood bags. So yellow H is technically for the blood bags, and that is for blood products. But all said and done, if you get a single best answer, H is always a safer option to mark. H will also contain the attenuated live vaccines. H will contain cell cultures which are used, or laboratory cultures and these things like these. So generally, just remember it's a laboratory waste. That is what is more important for you to understand. Red category, we already had a word. Please note that in the red category, we are going to discard anything which is rubber, plastic and tube. Repeat goes for repeat. So tubing, bottle, IV sets, catheters, urine bags. You remember blood bags goes to the yellow category, urine bag goes to the red category. Syringes without needles and fixed needle syringes with their needle cut. So fixed needle syringes with their needle cut go to the red category, but the fixed needle syringe, in case you cannot cut, that goes into the different white category. Vacutainers and glove. I would like you to highlight over here about the vacutainers. A special mention over here, beta, the vacutainers. What are vacutainers? Have you ever seen vacutainers? These are like small tubes and they are vacuum. So you take a blood sample and zip, the blood goes into that vacutainer. So that vacutainer, it's not possible for a doctor or nurse or a healthcare professional to reopen and discard the blood there in the yellow category and vacutainer in the red category. Vacutainer is all packed, it's sealed. So what we can do is that the vacutainer without blood, that's the only exception we are having. Vacutainer without blood, please note it is without blood will go into the red category, and vacutainer with blood can go. Can you see somewhere it was written, but please note that the vacutainers with blood, they go into the yellow category. Vacutainer with blood will go into the yellow category. Without blood, they will go to the red category. That is what you need to remember. Next coming is the white category. White category is for the sharps, and in sharps, please note all the syringes with all the needles, syringes with fixed needles, needle from tip cutter, puncture card, scalpel, blade, everything is white category. Blue category you remember is for glass and for implants. Metallic implants, sternal wire, giggly saws, orthopedic splints, implants, nails, plates, everything is metallic, and that is ortho implants. Ortho implants will go into the Ortho implants will go into the blue category, and glass will also go into the blue category. So now let's very quickly have a visual recap right now. The human and the animal waste, they go to the yellow category. The placenta, fetus, they will all go to the yellow category. You remember yellow A and yellow B. Then is the soiled waste. What is the soiled category? It is the yellow C category. It contains all the dressings and plaster. It contains the cotton swabs. Everything is yellow C category. Then is yellow, this thing, beddings and linen. What category? You remember G for Gadda. It is the yellow G category. Next in line, you have the expired or the discarded medicines. That is yellow D category. Cytotoxic drugs. They both are in the yellow D category. Microbiological waste, clinical waste. Can you see the blood bag over here? You can see all the vaccines, the live vaccines. They all are in the yellow H category. And in the lowest part, you can see all the fluid categories. That is the X-ray fluid, the body secretions, and the detergents. They all are in the yellow category. Talking about the red category, bache. Red category, you can see that this is the Foley's catheter, Urosax, IV bottle. Please note, blood transfusion BT sets will go to the yellow H category, whereas the IV bottles or the drip sets, that is red category. Heavy duty gloves, whatever gloves, blood stained, non-blood stains, they go to the red category. Syringes without needles, they go to the red category. Vacutainers without blood and Ryle's tube, that is red category. Talking about the blue category, you will talk about the broken glass, broken ampule, empty vials. Please note, filled up vials is yellow category. Metallic body implants, that is all is blue category. Coming over to the white category, the white category contains the scalpels, razor blades, sharps, needles. Please note syringes with fixed needles. That is white category. Lumbar puncture needles, all these are white category. So with that understanding, now let me take back to you where would you pre-treat the waste. Please note that you can see that these are the charts showing you the yellow category. You can see yellow A, B, C, D, E, F, G, H. There is something called as pre-treatment. Pre-treatment means before disposing of in your dustbin, you need to pre-treat, yes or no. So please note, it is nil for everything for yellow category. I can also show you the red category. The red category, the pre-treatment is not done. I can also show you the white category. Pre-treatment is not done. I can also show you the blue category. Pre-treatment is not done. In neither cases, no cases, pre-treatment is done except in only 3 categories in the yellow F, G and H. Will you remember that for me? Pre-treatment is done only for yellow F, yellow G and yellow H. F also, there is important thing. So X-ray fluid, you don't need to pre-treat it. What you need to do is X-ray fluid, you just collect it and you send it for recovery. Are we okay with it? So the CBWTF will take that yellow F category with the silver fluid and they will send it to that manufacturer. The disinfectants, you cannot disinfect directly and you cannot put the disinfectant directly into the drain. You will have to neutralize using some of the acids or the alkali. So if it is an alkali detergent, you use acid to buffer it. If it is alkali, you use acid to buffer it. So alkali or the acid has to be used to buffer the solution. And once you neutralize the pH, then you can put it into the effluent. What is effluent system, beta? It is the hospital liquid drainage system. Next is the infected secretions. Infected secretion like feces and all these things, pus and all these things, they are infected secretions. So technically you cannot dispose them directly. So we have to pre-treat it. How will you pre-treat these infected secretions? The infected secretions can be treated using phenols. They can be they can be treated using the hypochlorite solutions. They can be pre-treated using hypochlorite solutions or the phenol. Phenol is more important and it is more acceptable. It is what we use as 5% phenol and it has to be pre-treated. Next in line is the linen. Linen, that is all the gadda. So many big mattress you dispose of or the bed sheets where the person might have done stools, right? Diarrhea patient was there or that any typhoid patient was there. So you always need to cut the bed sheet or the pillow cover and then you disinfect it. Again, disinfection should be done using that same hypochlorite or the phenols. So we use cutting and disinfection. for the infected things. And for all the microbiological waste, again, you need to pre-treat it. This pre-treatment of the microbiological waste can be done using the chemical methods, like disinfectants like the hypochlorite, or we can use phenols, or we can use the mechanical methods. The mechanical methods would include the autoclave, hydroclave, or the microwave. So you can use any of the following to mechanically disinfect it and then you dispose it off. Did you get this point? So let me just go back to you and talk to you what is a common biomedical waste. I told you that in the common biomedical waste, this person will take all the waste. He will take only the yellow FGH if it is pre-treated. Otherwise, he can take it even if you do pre-treatment or you don't do pre-treatment. That is irrespective of the phenomena. So beta, we have discussed about the biomedical waste rules, common biomedical waste treatment facility, and the understanding of the pre-treatment of waste in the yellow FGH category. We have discussed about the categories of biomedical waste, the yellow ABCDEFGH, the red category, blue category, and the white category. Let us move to the next topic, the bags and the bins in the biomedical waste. So the bags and the bins in the biomedical waste could again be having 4 different categories: the yellow category, red, blue, and white category. The yellow category could be a bag. The red category could be a bag. The white category is always a puncture-proof, translucent, or a transparent bin. It always have to be a transparent or a translucent puncture-proof bin, common sense, because it's going to contain the sharp. Next is, what is a blue category? In the blue category, beta, we can use, for the first time I'm going to say, we can use 2 bins. Either we can use a cardboard bin. So we can also use a cardboard box or a bin. In rural areas where things are not available, we can use cardboard bins, or we can also use a plastic container. Plastic bin, which is blue in color, common sense. So it has to be blue in color, blue color plastic. The white bin need not to be white. It is translucent or a transparent bin, but it has to be a puncture-proof, solid-looking bin. The red and the yellow category, beta, they can be the bag. Yellow category, we already have discussed that the bag could be of 2 types. We can have the bag with the biohazard symbol. You remember that claw type of thing, biohazard. And a cytotoxic bag. Cytotoxic drugs with the symbol of C. And the red bag is always a red bag with the biohazard symbol. Simple. Next, I would also like to tell you over here that the bag has some certain standards. The bag should be more than 0.5 micron thickness of the plastic, and it should all be non-chlorinated. You remember? 27th of March 2019, we decided that we will not use the chlorinated bags. So the bag has to be 0.5 microns, more than 0.5 microns thickness of the plastic, non-chlorinated bags. In case you are talking of a COVID waste, it always has to be a double layered. It has to be a double layered waste, a bag with a label on it saying that it is a COVID waste. COVID-19 waste with a label and a double layered bag, that is for the COVID waste. Next is point number 5. What are the COVID waste handling guidelines which have been made together with the Ministry of Health and Family Welfare and the Forest Ministry? They had at the latest revision in September 2020, that is the revision number 4. These are the guidelines I'm going to tell you right now. So the COVID patient can be at 2 levels. So either that COVID, because the waste has to be generated by a COVID patient, common sense. So the COVID patient can be at 2 different places. Either that patient is in the home or that patient is in the hospital. If that patient is in the home, we call it as a home-based care. If it is in a hospital, we call it as a COVID isolation ward, COVID isolation hospital. So let us first talk about the COVID hospital guidelines. Very simple to understand. Beta, please note that anything which is generated by the COVID patient everything is not a biomedical waste. So please note that what is a general waste? That is what I would like you to know. What do you mean by the general solid waste generated by the COVID patient? General solid waste will contain everything, even the fruit peel-offs, discarded paper, carton boxes, empty bottles of the patient, or even the leftover food, disposable food plates, anything which is left by the COVID patient may contain some of the virus, but all said and done, that is taken under a general waste, and this is under the solid waste management guidelines. It is not considered as a biomedical waste. Point number one should be very clear. So that is your question one. Question number two, what will you dispose of in the yellow category? Question number two, in the yellow category, we will dispose of everything which is the yellow waste. That is the used mask. It also includes, please note, head cover, shoe cap, shoe cover. So that has been a lot of times asked in your exams. The head cover is made up of a material which is a yellow category. The cap, the shoe cover, disposable linen gowns, non-plastic overalls, everything is yellow category. COVID patient use mask, for face mask, tissues, toiletries, everything is yellow category. Red category will contain, this is 1,000 times doubt asked to me on social media. I would like you to highlight, red category contains all the PPEs such as goggles, face sheet, anything which is made up of plastic. Yeah, you're going to put it in a red category. Why would you put it in a yellow category? That is a separate guidelines. Some hospitals have made it as yellow. But the Government of India, revision number 4, September 2020, Ministry of Health and Family Welfare says that all the PPE kits which are plastic, they have to go to the red category. Why would you ask a CBWTF to burn it off, incinerator? It's not required. So the PPEs as goggles, face shields, splash-proof apron, that is the plastic apron, plastic overalls, hazmat suits, that whole thing, that whole covering, that alien type covering, hazmat suits, nitrile gloves, everything is red category. White will contain all the sharps, blue will contain the glass, nothing special. So I just wanted to have a discussion with you, beta. You should have clarity in your mind that where are you going to dispose of different types of PPT. Head cover goes to the yellow category, the shoe cover goes to the yellow category, remaining everything which is plastic goes to the red category, mask will go to the yellow category. Coming over to the home-based facility. In the home-based facility, now you don't have that fancy thing about the yellow category, red category, blue category, and the white category. It is very difficult to teach the doctors. Leave aside the people in the home. How can we tell them that you keep 4 different bags? Nobody will do that. So what we thought was, what Government of India, what the biomedical waste people thought was, let us put all that waste into the yellow category. So that created confusion. So please note that in the house-based system, in the home or the quarantine facility, everything by the COVID patient is a yellow waste. Simple. No red, no blue, nothing doing. We don't do that. If we start doing that, then the public will go mad, we will go mad. So what we have done is everything goes into the yellow category. That means even the syringes go to the yellow category. In home, syringes from COVID patient, yellow category. Urine bags, yellow. Some patient might be on dialysis. Some patient might be having, COVID patient will also have so many things, right? So please note that patients with other chronic disease, drain bag, urine bag, body fluids, tissues, mask, drugs, empty ampules, syringes, everything is yellow category. It's not yellow category actually, it's a yellow color bag. It's actually wrong to say about the yellow category. It is a yellow color bag that is there for the home-based COVID patients. And remaining everything like from the kitchen or from the waste food material, leftover food, COVID patients, not the patient themselves. So from the COVID patients, food from the COVID patient, that will all go to the general waste, that is the municipal waste. A special note of mention over here that even about the patient from the home-based COVID care or from the hospital-based COVID care, even from the solid waste management or for the yellow category, different categories. So there is a special note now. So the note says that wet and dry solid waste bags, that is the solid waste bags from either the hospital or from the home, should be tied securely and blah, 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 and should be sprayed with sodium hypochlorite solution. Very important. So they have to be sprayed with hypochlorite solution before handing over to the waste collector. Next is yellow color bag should not be used for collecting the general solid waste. We have already talked that. And about the feces should be there in the yellow bag or the container. And in case the person has done stools on a bedpan, the bedpan should be disinfected with 0.5% chlorine solution. That's a special note. So this can be your MCQ exam beta question, that the bags that are there from the COVID cases, the solid waste management, are they supposed to be disposed of as such? No, they have to be tightly leak-proof bag, and there is a gooseneck way to tie it. So you tie it, and then whatever is there like this again you put it down and again you tie it. So that is a double tying. So it's a leak-proof bag. This tying is called as a gooseneck tying, and this has to be done, and the bag has to be sprayed with sodium hypochlorite solution. So actually that completes your understanding about the biomedical waste segregation, categorization, and the COVID waste handling. Now coming to the last point, that some extra points, some miscellaneous points here and there. First MCQ is regarding the standards of biomedical waste treatment. Beta, in standards of biomedical waste treatment, I told you that there can be pre-treatment facilities. So we can use autoclave, microwaves. The standards of treatment for autoclaves is that we have to use at 121 degrees Celsius with a 15 psi pressure with more than 45 minutes. So at least for 45 minutes, this is the primary standard that we have. You can also have secondary standards of a higher temperature. Similarly, for a gravity flow autoclave, the primary standards are same answer, but for higher time. In a gravity flow, it is 121 degrees Celsius, 15 psi, but for 60 minutes, that is the primary target that we need to achieve. For microwave, this can be your question, that what is the indicator? The biological indicator is the Bacillus atrophius spores that are used as an indicator for the microwaving technique as a standard of treatment for pre-treatment of the biomedical waste. Now, when we talk about the incinerator, there has to be some standards for the incinerator also. Let us have a few words about incinerator, and then we'll probably come back to this point. Incinerator. Incinerator is of many types. We can have pyrolytic chambers. Pyrolytic chambers type of incinerator. Chamber type of incinerator. We can have single chamber incinerators or double chamber incinerators. Usually, in most of the places, it is a double chamber incinerator which is used. What do you mean by incinerator? Incinerator is very high temperature burning. So the temperature in an incinerator is 800 degree to 1050 degrees Celsius. If there are two chambers, that's what is most commonly used, double chamber. If there are two chambers, so the primary chamber should be minimum 800 degrees Celsius, and then the secondary chamber is 1000 to 1100 degrees Celsius. What do you do in pyrolysis? In pyrolytic chamber, what is so special in a pyrolytic? These are the best type of incinerators. So in the pyrolytic chamber, the temperature in pyrolysis would be pretty high. It is more than 1300 degrees Celsius. But general, if you get what is the temperature in an incinerator, beta, in the most commonly used incinerator, we are using 800 to 1050 degrees Celsius. Next point which can be asked is like, what is not allowed in an incinerator? What things are not applicable in an incinerator? Common sense answer, anything which is pressurized chambers, pressurized cylinders or gas cylinders, they will obviously not be used in an incinerator. Second is reactive chemicals. Third is also sharps are not put in an incinerator. And fourth is anything which contains heavy metals is not used in an incinerator. So reactive chemicals or explosives, they are not used in an incinerator. The standards for incinerator should be that the usual temperature maintenance should be there between 800 to 1100 degrees Celsius. In case of discarded medicines or expired medicines, if they are being incinerated, the temperature should be more than 1200 degrees Celsius, because we want complete combustion of that particular medicines. Also, the standard for incinerator should have a combustion efficiency. That is how much of the fuel that you are burning and what is the heat output. So you can't burn logs over there, wood logs. So they use very highly inflammable fuels. So the combustion efficiency or CE of the incinerator should be more than 99%. What is the combustion efficiency? What do you mean by combustion efficiency? It is the percentage of carbon dioxide in the stack area divided by the percentage of carbon dioxide plus the percentage of carbon monoxide into 100. So this is the combustion efficiency. It should always be more than 99%. And last, another standard could be that the gross volume reduction of the waste should be more than 85 to 95%. Of course, basic minimum should be 85. Ideal can be more than 95% reduction in the volume of the waste. So these are some of the standards for incinerator. That is what I was talking about, the standards of incinerator. That in incinerator, before incineration, you have to do pre-treatment if it was applicable. Yellow D of more than 1200 and the temperature should be 800 to 1050 degrees Celsius. Another point that is very important, another second point which is very important, very frequently asked in your exams is, what if the common biomedical waste treatment facility is not there? If the area is a rural area or there is no access to the common biomedical waste treatment facility, CBWTF is not there. Or in other cases, it's a very far-flung area. India is such a huge country that it's not possible sometimes CBWTF is available everywhere. So now in cases where, MCQ starts now, in cases where the CBWTF is more than 75 kilometers away, now it is difficult for the health facility to have a waste management. Now in that situation, you need special approval from the Director Health Services or the local area in charge to have the other alternate measures, that is deep burials or sharp pits or things like these. So now in rural areas or no access to CBWTF, you can use alternate methods. Now, for example, let us say you are running a health facility, you are running a sub-center. So what are the waste that will be generated in a sub-center? It could be any dressings you might be doing in a sub-center, a health worker will be doing, or it could be any deliveries which happen, placenta is there, or the fetus is there, or something is there, some animal waste or the anatomical waste. Then there could also be immunization waste. So immunization waste is particular important. So immunization waste, in an immunization waste, now the problem starts. There could be syringes, there could be needles, there could be vials, and there could be cotton swabs, etc. So now what do we do? Please note that in a rural area where there is no CBWTF, after approval from the Government of India, now the people can do different things. Either the biomedical waste that is generated could be animal waste or anatomical waste or dressing waste, anything. You remember in the yellow category, anything which was primarily of the yellow category, fetus, placenta, animal waste, anatomical waste, all those human parts, everything. So what we do to them is we can do deep burial. Please note, I am not saying that deep burial is the method of choice. Deep burial can be done. Or you send it to any nearest area for incineration. Incinerator, if you have private incinerators, you send it there. That's the best. But in case that is not possible, you can do deep burial. There is a provision under the Government of India. Now the question wala asks you, what is the criteria for deep burial? Please note that the criteria for deep burial, first is that the 75 kilometer CBWTF should not be available. Second criteria is that the water table, wherever you are doing deep burial, the deep burial should be more than 2 meters deep. Okay. It should be a big hole of 2 meters and the water table should be below 6-7 meters below that point. So the water table should not be above. Otherwise you will be contaminating the whole country. So please note that the deep burial can be done as low as 2 meters deep. You put whatever you want to put. Make sure that the water table is more than 7 meters below this. 7 meters below this, the water table should be there. For 2 meters, you can go inside. And after putting that placenta or whatever thing we want to dispose of, then you put a layer of soil. You put a layer of soil always over it, and it should be covered. This is called as deep burial. Now, next time the people will come, you remove this point, you remove this cover, you put more material into it, and then you again put soil over it. Are we getting it? That's how the deep burial thing works. And deep burial should always be more than 2 meters, and the water table should be below 7 meters from that, and within 75 kilometers there should not be no CBWTF should be available within the 75 kilometers. This is the criteria for deep burial. And how much soil you put every time? How much soil? It should be more than 10 centimeters of, at least 10 centimeters of soil should be there. At least 10 centimeters of soil should be put. This is the criteria for deep burial. So now we have covered about the animal waste or anything which is infectious or hazardous things. Now coming to the other problem about the immunization waste. In the immunization waste, there could be needles waste, there could be sharp waste, there could be a vial waste or a glass waste, there could be syringe waste. So many things happening in the immunization, how to dispose them. What you do is, you cannot do deep burial. It doesn't make sense, right? So what you do to this is, beta, you can take this and put it into a safe container. That container is called as a sharp pit. It is called as a sharp pit. But before putting into the sharp pit, you should always disinfect this material and then put it into a sharp pit. That's all. So what is the MCQ people will ask you? How to disinfect it? We can disinfect it using 0.5 to 1% hypochlorite. I'll repeat it. I'll repeat this line. You can disinfect it. Disinfection can be done using 0.5 to 1% hypochlorite solution. Hypochlorite solution. This has to be done for 15 to 20 hours. And after dipping the syringes or the needles in for 15 to 20 hours in 0.5 to 1% hypochlorite solution, now you put them into a sharp pit. You put them into a sharp pit. The sharp pit is nothing but a container. It should always, mostly it should be brick lined. It should be cemented. If not cemented, brick lined. If not brick lined, at least a metal container should be there. So the sharp pit should be size 1 meters into 1 meters into 1 meter. So it should be a cubical kind of thing. It should be a square thing. And the 1 meter, 1 meter, 1 meter, and the sharp pits are there inside the ground. It should always be brick lined or cemented, and the sharp pit should always be covered. It is always advisable to have a parapet and to label it as a sharp pit, but of course at the village level sometimes it's not possible, but it has to be covered, and usually with a signboard saying a sharp pit here, so that you should know what cover to pick it out. So sharp pit should be there. It should be usually labeled. And that's how we dispose of the waste in the rural areas where there is no CBWTF after approval from the appropriate competent authority in the Government of India. The last point is, how about the common biomedical waste people who are handling it? So they could be in your hospital. You could be the medical superintendent, or you could be the doctor in charge, or you could be the person who's in charge of the biomedical waste. So we ensure that the biomedical waste handlers, anybody in the hospital or in the CBWTF, we ensure that anybody who's handling the biomedical waste should be minimum vaccinated to hepatitis B and vaccinated to TT, tetanus toxoid. So we ensure that the persons who are handling CBW, handling the biomedical waste, they should have minimum this, and they should be wearing the 6 elements of the PPE. What are the 6 elements? Everybody knows it. They should be having the face shield or the mask, whatever. Then the eye cover or the goggles, head cover or the cap, gloves, boots or the shoe cover, apron and the gown, apron or the gown. So these are the minimum 6 elements for biomedical waste handler, and they should be vaccinated for hepatitis B and tetanus toxoid. So with that, thank you so much for watching this mega module on the biomedical waste management rules in India. See you in the next chapter some other time.
Hi guys, please subscribe my channels.